Hello, everyone, and Happy New Year. Today, we are publishing the ISUOG guideline on the third trimester obstetric ultrasound. It's the first time we publish this guideline. The ISUOG has published in the past guideline on the first trimester ultrasound and the second trimester ultrasound, but this is the first time we're publishing the guideline on the third trimester obstetric ultrasound. In this short video, I'm going to share with you a very, very short outline, or maybe sort of one section from the guideline. And I'd like to maybe take the opportunity to thank all the co-authors who have contributed to this guideline. I'd like to really get you to move away from the fact that this third trimester ultrasound is just a gross scan to have almost a checklist approach. And this is a checklist that we included, from viability to looking at the placenta, fetal presentation, the biometry, the assessment of the amniotic fluid volume, fetal Doppler when indicated, and the fetal anatomy in the third trimester. And this is the views that you might need to obtain during this ultrasound scan, depending on the risk profile, depending on the indication, depending on the history. So if the woman had a previous cesarean section, have a placenta previa, you might need to look for signs of morbidly adherent placenta. If we would to perform or plan routine third trimester obstetric ultrasound scan, what would be the gestational age window? And that depends very much on the purpose of the ultrasound scan. If the scan is mainly really to identify or detect gross abnormalities, small for gestational age, large for gestational age, in this case, we need to do it later in pregnancy, about 35 to 37 weeks. If it is for anomalies, detection of anomalies, in this case, you will need to do it earlier, 31 to 33 weeks, because it's a trade-off between the optimal visibility of the fetal anatomy, which tend to be more difficult later in gestation because of the fetal position, and the optimal accuracy of the fetal gross assessment, which tend to be later in pregnancy. And this is evidence to support that. The later the ultrasound scan in pregnancy, the more accurate in detecting small for gestational age or large for gestational age. So if you see this data, so this is the predictive accuracy of the estimated fetal weight on the ultrasound scan for detecting small for gestational age. And you see the difference in the area under the curve, or the AUC, is a measure of the predictive accuracy, the performance. And here later, so 35, 37 weeks is 0.933, earlier 31, 34 weeks is 0.906. So it's higher at a later gestation age. And the same, exactly the same for large gestation age. If you use estimated fetal weight, you compare, you find that the area under the curve, the AUC, is higher, 0.61 later in pregnancy compared to earlier in pregnancy. And therefore, the recommendation in the guideline is that the timing of the third trimester scan, when indicated between this gestation age window, 32 to 36 weeks, should be decided upon the maternal fetal characteristics, the risk profile, the objective of the scan, and the resources. And then the various sections of the guideline, from how to determine gestational age using ultrasound scan in the third trimester, what biometry variables that you need to you would use, and how accurate is this estimation of the gestation age, or the various section, the checklist that I showed you, is all included in the guidelines. So I'm going to stop here because it's a very short video, but I hope that stimulates you to go and read the guideline, and I really hope that you find it useful for your own practice. Thank you very much for your attention.